So thank you all for joining us. It has been a pleasure listening to your talks. To get started, I'm going to ask Diana to tell us a little bit about herself. She's a glaucoma patient, and she has a story we want to hear, and then we'll jump right into our questions. Diana?
Is this on?
So keep writing those questions. They will come around again to pick them up. I think we have some questions on the tables here, so we can get those sent my way. Keep writing those questions. They are here for you to answer your questions. Thank you. Go ahead, Diana.
Okay, thank you. I'm the patient up here, and what did you want me to do?
Tell us about yourself and your glaucoma journey.
I first started having difficulty with my sight. I'd had great sight. When I was 24, I got an uveitis in my right eye. And since I'm steroid sensitive, they couldn't give me big steroids so I took drops for about 8 or so years that I got glaucoma. That was back 24 years. I was 24 years, and that was 55 years ago. So I've had glaucoma for not quite 55 years, but whatever. And that was kind of early days. So the right eye continued to have glaucoma. I have low pressure and steroid sensitive. So I had a trabeculotomy done and various things, but there wasn't a lot going on that many years ago, not like the wonderful things today. I did finally have to, the eye was blind, and it hurt, and so I had the eye, had the eye taken out and have a replacement, a prosthesis, and which has been fine, which has been kind of an interesting journey. But then the other eye got glaucoma shortly after that. That was kind of a jolt, to say the least. And I started coming, I live in West Texas, but I started coming here to Dr. Feldman at Glaucoma Associates, and I had the SLTs, and the things, and lots of drops. I was extremely compliant with my drops, I just want to say that. But the long and the short of it is that I was losing a bit of ground. And then about, was it 4 or 5 years ago, I had a Zen put in, and it's been fabulous. And I don't take drops, and we had a little needling that was extremely successful. So I'm most grateful for all of those that do research in glaucoma, and of course all of our good medical staff and Dr. Feldman. And so that's really kind of my journey.
Bianca, do you want to share yours too? Tell us a little bit about yourself.
Of course, thank you. I'm Bianca Beach. I'm the founder of Foresight Pilates, and I was diagnosed with glaucoma at 20 years old. I started losing a significant amount of vision around 16 years old, because when I was 11, I had 6 eye surgeries, half of which were emergent, starting off with 3 retina detachments and then a cataract replacement. I had strabismus surgery when I was 6 years old, so I had a background in that already. Extremely myopic. I was born a -12 in both eyes. So the glaucoma that I have now is open angle as a result of all of the trauma from a very young age. So I've had 4 SLT procedures for glaucoma specifically, and now I'm on 3 eye drops. So everything is stable for the last 3 years, which I'm really excited about. It's been a long journey to get there, and I credit a big part of my current lifestyle to the exercise. So I'm a big advocate for glaucoma and exercise, and that's why I'm here for you all today.
Excellent. Well, yes, they deserve some different patient journeys there. So we're going to jump right into it. Let me start with the exercise portion. There's a question here that says, what low-impact workout is recommended for one who has heart disease or heart problems? What would you recommend?
I've been teaching Pilates for 5 years now. Pilates is very naturally low impact, so you're not going to find a lot of the heavy, intensive breathing or strain that you'd find in higher intensity workouts like, say, CrossFit or running for very long periods of time. So Pilates is a great way to do that. Yoga is also a wonderful practice. You just have to be really careful about the positions that you're putting yourself in. We hear a lot about downward dog, which is not the best position for glaucoma patients because of the extended period of time that you're upside down or inverted. So anything that you have your head below your heart for long periods of time is what's going to increase that eye pressure. But studies that I've read have shown that exercise done modified correctly for glaucoma can have up to a 10% decrease in IOP. So that's your quality of life right there.
Well, that's wonderful. Raj?
Another thing that I touched on was just walking. Power walking can be a great form of exercise for about 20 minutes a day, and most people can do that as well.
Thank you. So let's talk a little bit about low vision. We had a great low vision presentation there from Amy. And I have some questions here. Two of them I'm going to bunch together. The first one is, what are some examples of the apps that people can use for low vision? And the other one pertains to whether there are government programs that provide funding for low vision tools for patients with glaucoma.
Okay, yes, both great questions. Starting with the apps, like we said, your smartphone has a lot of options already there for you. A handful of apps that could be helpful that I've gotten feedback from colleagues or clients. There's one called Be My Eyes. And so it started out as a volunteer program, and basically it would connect you, for example, via FaceTime with somebody who's a volunteer through the app, and the person who is having trouble with their vision could rely on that person via the phone to help them find what they're looking for or direct them if they're in an unfamiliar area. So for example, finding the exact type of pasta sauce on the shelf at the grocery store, they all kind of start to muddle together and blend. I can't find the exact one I want. You can call them and they can be the eyes for you. That one's been out for a little while, and they've also had an upgrade to now it includes the artificial intelligence and the AI, so you don't always have to connect to a live person. You can also have the camera take a picture and process the information and give you details there too. So that's a big one people enjoy. With those Meta Ray-Ban glasses, it also is compatible with the glasses and can connect with that camera too. Another one that one of my colleagues loves is called PixieBot, PICCYBOT, and it's just another artificial intelligence one that can help with reading out loud and using the camera function there. Reading a menu that's posted on the wall, reading a menu at a restaurant that's in your hand, just helpful for those things. And then as well as magnification apps, there's a built-in magnifier on your smartphone, and being able to utilize that can be helpful. As far as the government programs, for those of y'all that are local and here in Texas, there's something called Texas Workforce Commission, and they have segments for people who are visually impaired or blind. They also classify that based on age range. So there's the vocational rehabilitation for those that are 54 and younger who are seeking employment or maintaining employment opportunities. And then 55 and above, the older individuals who are blind program. So not necessarily who are wanting to get back into the workforce, but could still use services and assistance for funding training like the mobility cane training or the low vision exam, and purchasing devices like the magnifiers or digital magnifiers. So that's the government resource here in Texas. I think any state though, for those that aren't local, should have something to that nature for them. And so just kind of looking into those opportunities there. And then also recommend a lot of states have a lighthouse for the blind in the major cities, so they could have some of those resources available too.
That's excellent. You know, managing to keep a list of resources of patient needs is one of the things that I like to do. So I've run around the little exhibit area there, finding anything that any of my patients will find useful. I've picked up a magnet from the people who gave out the computer because I might have a patient ask about that one day. I've picked up the little card from the ladies who help people who want to work. You know, there are all these resources that are available to us that sometimes we're unaware of in our communities, and it's great to be able to actually have a list. I wish we could come up with a list, a regional list in every city or state that helps anything from books to transportation. I apparently found out from one of my patients there is a way where the government actually pays for transportation. She gets to do this Uber thing, and she calls an Uber ride to go wherever she needs to go, whether it's the doctor's office, apart from the support that Medicare gives. And there's all sorts of resources out there. So reaching out into your community, go into the lighthouse, like they've said, to find out what is available. Take your phone, take your iPad, let them make the adjustments so that you can live as close to sort of normal, like we talked about, as you possibly can, as you evolve into this new phase in life. So I'm going to take some questions that actually somewhat relate to that. And Diana is going to answer one of the questions. Somebody had a question for you. It says, how do you stay positive and manage stress while living with a chronic condition? And I want Clay to sort of hop onto that question by answering the question for him that talks about how does one start journaling to help themselves with glaucoma, and why does journaling help? So Diana, I'll let you go first.
I actually am a person of deep faith and a pretty
We're going to need you to, there we go, your microphone.
Sorry. I'm a person of deep faith and a pretty optimistic person most of the time. And so that, I think, was a big help. I also have taught for many years at the University of Texas in Permian Basin in psychology. Clay, you and I have a similar background, I think. And but I did most of the neurological type of courses, sensory courses and all, but I loved teaching positive psychology, which is how people flourish and how we can help others to flourish by knowing how they flourish. And one of the things in that is, and while I was teaching it, I was also the student because I was learning a lot for myself. And it really helped me with my glaucoma journey as well as all throughout my life. But one of the things are the strengths that we have. And I think that we don't think about that as much. All the research that has been done worldwide has developed a list of 24 strengths. Things like kindness, teamwork, spirituality, love, resilience, things like that. But gratitude, which is one of them, is the gateway, they feel, to all of the strengths. And so having gratitude just in the little things of every day or the big things that happen in our lives is a real help to allowing us to sort of muster through the more difficult things. And I had my students have to keep a gratitude journal. I keep a gratitude journal. I don't do it just every single night, but I should. And it's the idea of just writing down. I'm not a journaler. I do not do a big journal. I just never would. But just writing a phrase, 3 phrases each night. It could be as simple as, I was so glad there was ice cream left so that I could watch TV and have ice cream, or whatever, But it could be also something quite important to family, to self, etc. But gratitude, and the flip side of that is to help others so that they can experience that feeling, is something I think that's been a mainstay in feeling like like glaucoma is right here, no pun intended, in the peripheral, but life is right here, if that makes sense.
Wonderful.
Yeah, and to follow up on how to use journaling to help with our mental health, and I agree with everything Diana said. Being gratitude or focusing on gratitude, being able to write down the things you're grateful for is really going to create a focus towards where you spend a lot of your time with your thoughts. And so being able to remind yourself a lot of those things that are positive, that are reoccurring in your life, brings a new frame that you begin to focus on. And there are multiple ways to use journaling. And another one I like to use is that oftentimes, even sometimes as a precursor to sharing what it is I'm feeling. Right? Sometimes we don't feel comfortable sharing the depth of our emotion with another individual. But when we're able to journal the feelings we have that are associated with what we're experiencing, it allows us to kind of process those emotions. Oftentimes I'll have thoughts and feelings in my head and it feels like they're just bouncing around. I'll have a thought that I think is really coherent. It makes a lot of sense. And then the reality is that I'm ping-ponging between a bunch of different things that are going through my mind. And when we're able to write those things out, it becomes a more linear fashion. It takes those jumbled thoughts, half-formed, and it turns it into a sentence. And so it gives a little bit more focus and fully formed thought, almost like we are going to speak and share with an individual. But oftentimes, if we're not ready to take that step, if there's emotions we're feeling that we don't quite want to share, it's a way to kind of express the emotion. And so it's writing down the feelings that are associated with what you experienced that day. The feelings that came up with your meeting with your doctors, your meetings with your friends, right? Feelings associated with where your readings were for the day. Being able to just formalize those thoughts allows us to more healthily process through it. And then that oftentimes, right, coupled with the gratitude journal, being able to turn from that and also remind ourselves, what are the positive things I'm feeling? What I am experiencing a lot of the turmoil, but what are the other things that I'm also going through in my life? And so I would say, yeah, that's helpful ways to use journaling.
Thank you. Dr. Davanian, this is for you. So how do you recommend mindfulness for your patients? And if somebody asks you, what will be your direct recommendation?
So certainly, sometimes patients ask, Doc, does stress, is stress related to my glaucoma? I'm very stressed out right now. Can it increase my eye pressure? And, the answer is, sometimes it can. And sometimes I do recommend mindfulness meditation. Now, some people think of meditation as just sitting there and not thinking about anything, or sitting there and focusing on your breathing. But there are multiple different types of meditation. One thing that Clay actually taught me this weekend was just working with your senses, just rubbing your fingers together to help you be present, the deep breathing. Those are different things you can do, and for about 15 to 20 minutes a day. And something else you can try to do is when you use your eye drops, a lot of us are on eye drops, and you use them twice a day. Use the eye drop, close your eyes, and do it then. Do it for about 15, 20 minutes during that time. In the morning, it helps you get ready for your day. At night, it helps you, finish out the day. So that's an easy way to just even get started. And then it can be a routine that not only helps your glaucoma, maybe it reminds you to take your medication. It's a 2-in-1.
Do you have anything to add to that, Bianca? Yes.
Two things. The first thing about the sensory is, and I just thought of this as you were speaking, they have these things called fidget cubes now, and it's like a dice essentially, and all different sides of it have a different sensory experience. So they make little clicking noises, or you can get some that don't make noise at all, and that's a really helpful thing to help get your brain out of whatever it is that you're overthinking and go into your body more. They have, I know fidget spinners were a really big thing a few years ago, and we have foster kittens at my house, and they love playing with those. And another thing about the journaling that I was thinking of too is when I was very young, my dad got me an audio recorder. So those of you that maybe have difficulty writing things down or typing, saying out what you're grateful for, even on your phone through the voice memo app, is a really helpful tool for that as well. If you don't have a pen handy or you want to get something out, those are great tools in the doctor's office, getting, just extra tools and ideas for use.
So this question is interesting, but I think an answer can come through from every single person up there on the podium, because I'm going to flip it both ways. The question is, how does one cope when you don't receive support from loved ones, right? But then there could be another question is, how do you support a loved one? So as a patient, what would you like to receive in support? And also, if you don't receive support, how do you cope with that? Go ahead. Anybody can start.
Sure, I could speak on part of that. So I'll speak on how to cope when we don't feel like we have support, right? And I think that goes back into kind of what I was mentioning at the beginning of my talk, and that's naturally letting yourself experience the grieving process, right? We tell ourselves, oh, I need to move past this. Oh, like I should be at a different spot. And the reality is that is a hard thing. It's allowing yourself the freedom to feel the heaviness of that moment. And I know that's probably not the answer you're looking for, but that is a very healthy precursor to being able to move forward. Sadly, we cannot force people to understand. And so sometimes there is going to be that distance between you and another person. And now there are strategies and things that might take a bit more time to talk about, how to have those conversations with people, how to engage with others in a way that can help them provide support to yourself, learning how to communicate what it is you're going through. And in the event that you are not receiving support from family, it's taking a broader focus sometimes. Where else can I receive support? What other options might I have? Of course, initially, we'd love to have that support from family. We'd love for them to be a part of our process and a part of that support system that we have. But we also want to be mindful that we do have other opportunities oftentimes. They just might not be in our wheelhouse currently. It's allowing yourself to explore other options that might exist out there for yourself.
So in terms of support, what would you like for caregivers to provide? Sometimes we just don't know what those needs are. So it'd be nice for us to hear from a patient's perspective, there's some that are apparent, you might need a ride somewhere, but should I be canvassing to find out what those things are in the community that you used to like doing that we can still make happen? There's stuff. So I want to hear from your viewpoint what you would like your caretakers and family support system to do on your behalf, sometimes without asking.
My family knows now which side to walk on when we're walking together. I have way less vision on my left-hand side, so I like to walk on someone's left. And then if I'm in big crowds, my sister or my mom or my boyfriend, they all know to grab my hand, because I really appreciate when someone helps guide me through a space, especially a space that I've never been in before. That, I think, is one of the most anxiety-inducing experiences, is going somewhere that I've never been in that room because of depth perception. And it's hard when there's a lot of people in one place and you can't see where they're coming from or when someone's going to appear next to you. So I think having communication with the people around you, I've even said to strangers or my boss or someone on an airplane, if I'm sitting by the window and there's people on my left, I say, hey, just to let you know, I'm low vision on this side. I'm so sorry if I accidentally, bump your arm. And I've never been met with someone who was not kind or happy to help me. People, we want to help each other. That's what we're all here for. And I think that not being afraid to communicate with the people around you in every situation has really taken my quality of life to the next step.
Well, I actually have to agree. I'm actually the opposite. I like to, since I have low vision on the right side, I walk with people so I won't bump into them on their right. But what I've noticed, and you're right, on planes or other places, that if there is something that you're concerned about and you really kind of need to say something, people are just delighted to help you. I do think that we as humans want to help other people. We just don't always know if there's a need, in those little things just in the marketplace or wherever. And so I've found that to be true as a personal experience. I have 20-something, I have grandchildren, and I don't have 20-something grandchildren. I have that are in their 20s. And it's funny because when we travel, I don't know if they get together, but there's always someone right behind me, in cities. And I have a daughter who lives in London. It's just stepping around is sometimes a little bit chaotic. And so I always hear this voice, there's a step there, there's a step there. And so that's family, but my friends do that too. A lot of the time, here's the secret, I can see the step, but I might not see every step, so I never say anything, and I say thank you, and all. But it is, I think people in general want to be a support group for people, for us. And but sometimes they just don't realize how they can do so.
Great answers. I have about 5 more minutes, but maybe I'll take 2 more. And I'm going to divvy up these questions. What I want you to think about for both Bianca and Diana, I know, Diana, you kind of shared one of them, is there was a question here about whether you had a motto of some sort that you lived by, and you talked about, your gratitude journal. If there is one, Bianca, you'd let us know. I will answer the question that talks about my vision has a heavy haze limiting my activity. Is there any possibility of lessening haze? And then there's the question of this particular question refers to if there's a particular app that you would recommend for the guided muscle relaxation exercise. So that question goes to you, Clay. But let me answer the vision question about heavy haze limiting activity. The thing about glaucoma is, looking at the slides that I presented earlier on today, you do, and I actually mentioned it, that people come in and talk about a dimming in their vision. And some of that dimming that is perceived is actually, it's visual field loss. In doing glaucoma surgery, I'm always careful to mention that even when we take your cataracts out, there's fragments of vision that are provided to you by a clear lens being in place, but the vision loss that you have from glaucoma is usually permanent. The important thing is that the vision that you currently have is optimized in every single way that you can. So we can't get rid of that dimness or that haze that you see. But what we can do is make sure that you have the right prescription. If you have a cataract in place, that's taken care of. If you have a posterior capsule opacity, that's addressed. If you have an epiretinal membrane, anything that will impact the quality of your vision can be addressed. But what I suspect here is that haze that you're talking about is usually attributed to the glaucoma in itself. And vision loss from glaucoma for right now cannot be improved. But what we can do is check in on everything else and make sure those things are optimized. So I'll take that question. You can go ahead and start, Clay.
Yeah, sure thing. So as far as progressive muscle relaxation goes, I don't know of a specific app, but one of the wonderful things about mental health becoming much more prevalent is that there's a lot of different resources out there. And so one of the things that I typically do for progressive muscle relaxation, and I apologize for not getting to mention it earlier, but I'll go into YouTube. And if I just type in those words into the top, multiple videos will come up. And someone will guide you through the process. And so you can just press play and listen. And it's a script that pulls you in the direction to go. Now there's multiple ways to do it, and there's a lot of variances to it that can also be helpful. As far as apps themselves go, there's one I really like that I believe is still free. It's been a while since I've been on it, so you shouldn't have to pay for anything, but it's called Empathy. And it's an app that prompts you to spend time with your feelings, spend time with your emotions, and kind of gives you a set amount of time in a safe place to really experience your emotions for the day. And so that's an app I recommend that I have found to be helpful. And then as far as progressive muscle relaxation goes specifically, I would say just type it into YouTube. There's wonderful videos out there, and if the first one doesn't agree with you, I think there's about 50 more right behind it. Yeah.
So we'll take the personal motto or mindset question, and Bianca, we'll take an answer from you. And also, Arash, what are your thoughts for a patient who asks you, what do you think I should focus on? Whether it's any of the living with glaucoma things that they can change their life doing. I guess it's going to be based on patient, but we'll take those two questions and then we'll round up the panel session.
As far as a motto goes, I wouldn't say that I have something very specific that I have in my brain, but I do really focus on the things that I can do. I think it's very easy as patients to see a list of things that we can't, and that weighed on me a lot as a young teenager. And the older I got, the more, and was going through college, the more I had people around me, my friends, my professors start to say, oh, but you could do it this way. And I really started to take a step back and think about that. You know, when I learned to drive, I had already lost a lot of vision, so no, I can't see my side view mirror, but I can turn my head all the way around to check and change lanes. I still have that ability. I can't do, a certain form of exercise. I'm not gonna lay flat on my back and try and bench 100 pounds, but I can do Pilates. And so thinking of all the different things all the resources that are available to you that you can still do, just because we don't have the full list that somebody else might have, doesn't mean that our quality of life can't be as amazing or even better because we have clarity to see what is on the table for us with our diagnosis.
And then as far as what to focus on, as Dr. Tosin pointed out, once you lose vision from glaucoma, it usually does not come back. So what I always tell patients is focus on the vision you currently have, kind of like the glass half full kind of picture. This is what we currently have. This is our baseline. This is what we're starting with. And let's focus on what we can do with the vision that we have. different ways to get around with the vision that we have, different ways to get low vision help to help you with the vision that you have. And let's focus on doing the treatments to maintain what you have. And that in itself helps a lot of patients not focus on what they've lost, but rather than what they still have, and be thankful for what they still have.
Thank you very much. So those are amazing answers. For the question about where can I find low vision help, or in every city, there's always a low vision specialist. We have Amy, and we're going to have another person who will be on the next panel who provides low vision help in the DFW area. So whatever city you're in, there is a low vision specialist there. You can just Google that and make an appointment to get help. Thank you all very much for your questions. We're going to move on to the next session, but before you leave, we're going to take a quick group picture, and then we'll move on to the next.